At the moment, we've got a number of projects based in the Manton area of Worksop, which is one of the highest areas of multiple deprivation within Bassetlaw. We are working with group support, we're working across volunteering, and we're working across social prescribing to ensure that there is equity of access for people for whom that hasn't always been the case. Because there are low numbers of groups within that area, there are lower numbers of organisations offering support. We employ social prescribing link workers on behalf of Newgate and Larwood primary care networks. It's a great benefit to us to have those connections. We know what's happening at grassroots within the communities when groups are new, when groups are having challenges, when groups need volunteers.
So we are here today in the Willow Garden because it's the heart of the community. It's conveniently located in Manton with an easy access to everybody, and not many people know about the garden, so we thought it would be a good way to show them the garden and what we can actually do here. We are just promoting healthy eating and also physical activity, so we are trying to encourage people to eat more fruit and vegetables, so we are serving vegetable skewers and fruit skewers for those who are not convinced to eat vegetables yet.
Well, our relationship with yourself has been there for a number of years, in fact decades, so we've got a good platform to work with. And the staff who are working with you now are completely integrated with us. They are part of our team, so we don't see you as a separate. I think that's the magic, really. You know, that's vital for survival. And beyond that, you also know how the local people behave. In some of my patients, you have really made a big difference. Something that as a GP on my own, it is almost impossible to crack.
So I'm working currently with the St. Paul's Church, also with From the Heart charity, which are an amazing charity. Yeah, so we work closely with Your Health Nuts today, and we've made those healthy skewers, vegetable skewers and fruit skewers with them. And we would like the community to take an advantage of healthy eating today, and also to move more and to be more active about making those lovely planters. And hopefully we'll be able to promote some cooking and also growing. So the incentive for people is to come here to plant and then grow things and harvest it and cook it and eat it.
Very often people need different levels or different types of support to be able to actually access the service or access the support that they want. So we work really hard to ensure there is equity of access for people, to make sure that the transport is available for somebody, to help them find small pots of funding for an individual, which means that they can actually have the right clothing to go and do an activity that will benefit their mental health and will bring them further away from clinical solutions and help support more social solutions. They are less reliant upon a medical model, and actually they become much more self-reliant and much more able to resource themselves the support that they need through initial hand-holding, through initial, perhaps it would be somebody accompanying them to the groups, but it's making sure that we do whatever we can so that people have equity of access to services.
The social prescribing role within the partnership model of working is an absolute credit and strength. It ensures that people are supported not just around their physical health and mental health, but around those wider determinants of health and the building blocks of health that we know impact people's overall well-being. It ensures that people are supported and signposted to the most appropriate place to offer support and care for people. We know that people attend our accident and emergency department more for social determinants of health than actual accidents or emergency needs. And that's not just anecdotal evidence. There's been DBH commissioned an organisation to go and assess from a patient perspective the use of accident and emergency at Bassetlaw, and I did hear that 80% of the people in AED on that day were for social reasons, not for health reasons. So the loss of that would just be devastating.
I'm very proud to work for BCVS, and as an organisation I know our staff are really proud to be part of a partnership in Bassetlaw that is fantastic. It's fabulous. We work well together and we work really hard together so that we don't duplicate resources. We make the most of what we've got. We take the opportunities that are present, and we also look for the opportunities and look for different ways that we can help our population remain healthy.